Hi guys, it's me, Professor D, and welcome back to my channel. If you're new here, guys, I do NCLEX style questions. I help prepare you for the NCLEX and big exams such as HESI or ATI. On this video, I'm going to be covering pharmacology, and to be more specific, I'm going to be going over these respiratory pulmonary meds. If you haven't done so already, please don't forget to like and subscribe below. Be sure to check me out on my other social media platforms such as TikTok and Instagram. My handle is still the same, Nexus Nursing. So without any further ado, guys, let's get started. The client with asthma asks, why should I use corticosteroid inhaler instead of prednisone? Which statement by the nurse would be most appropriate? 1, the lungs are incapable of utilizing prednisone to decrease inflammation. 2, the inhaler costs less than prednisone, which is why it should be used. 3, the inhaler will not cause systemic problems that prednisone does. Or 4, prednisone is not on your insurance formulary and the inhaler is. Okay, guys, and the correct answer is 3. The inhaler will not cause systemic problems that prednisone does, such as what? Causing excess cortisol. Okay, we don't want that. Now let's look at our other choices. You have 1, that the lungs are incapable of utilizing prednisone. That's false. Throw that out. 2, the inhaler costs less. Stop. Whenever you get a nursing test question, you're never going to base your answer off of money or insurance. You're always going to base your answer off of what's best for the patient. So that gets rid of choice 2 and choice 4. Next question. The client diagnosed with tuberculosis is administered Rifampin, an anti-tubercular medication. Which information should the nurse discuss with the client? 1, instruct the client to consume fewer dark green leafy veggies. 2, explain that the client's urine and other body fluids will turn orange. 3, encourage the client to stop smoking cigarettes while taking this medication. Or 4, tell the client to increase fluid intake at 3,000 milliliters an hour. Sorry guys, my lashes are bothering me. Okay guys, the correct answer is 2, explain that the client's urine and other body fluids will turn orange. This is normal expected side effect of that medication. You have to warn them, otherwise they're going to freak out. And you also want to teach them, for example, if that patient's wearing contacts, for the time that they're taking that medication, they need to switch to glasses, because the secretions not only is going to be in the urine, it's going to be all bodily secretions, right? So even their lacrimal glands, their tears are going to secrete orange fluid, and it can stain the contact lenses. So you're going to tell them to switch to glasses for that time being. Now, let's look at our wrong choices. Instruct the client to consume fewer dark green leafy veggies. Dark green leafy veggies full of vitamin K. It has no effect on this medication. We'd be more worried about vitamin K for patients who are taking what? Coumadin, right? Choice 3, tell them to stop smoking. Okay, great. While taking this medication. No, they need to stop smoking, period. So that's wrong. And then the last choice, tell them to increase fluid intake. We love patients to drink lots of fluids, but the fluid intake will have no standing on this medication. Next question. The client's having an acute exacerbation of asthma. The healthcare provider has prescribed epinephrine adrenaline subcutaneously. Which intervention should the nurse implement when administering this medication? 1, administer the medication using a tuberculin syringe. 2, dilute the medication to a 5 ml bolus prior to administering. 3, perform a complete respiratory assessment. Or 4, monitor the client's serum epinephrine level. And the correct answer is 1, administer the medication using a tuberculin syringe. Guys, this medication has to give at very, very, very low doses. I'm talking about 0.2 to 1 milligrams, the most, right? So we want to make sure we give it a tuberculin syringe just to make sure that we give that tiny, tiny little bit amount and we don't accidentally give that patient too much. Now let's look at our wrong answer choices. 2, diluted. For what? We're giving this medication sub-Q. There's no reason to dilute it in a 5 ml bolus. We're giving the sub-Q. What's the next one? 3, perform a complete respiratory assessment. If a patient's in respiratory distress, that's not the time you're doing a complete assessment. That takes time, okay? This patient's in respiratory distress. We already know they're in respiratory distress. What are we doing a complete assessment on? What is that complete assessment going to tell us that we don't already know? And that's why we're giving this medication. Come on. So that's wrong. And then choice 4, monitor the client's epinephrine level. There's no such thing. There's no such thing as an epinephrine level to monitor. So the correct answer is giving that medication in a syringe. In the tuberculin syringe, to be more precise. The nurse is preparing to administer the following medications. Which client would the nurse question administering the medication? 1, client receiving prednisone, a glucocorticoid who has a glucose level of 140. 2, client receiving Rifampin, an antibiotic who has a white blood cell count of 57. 3, client receiving heparin, anticoagulant who has a PTT of 78 seconds with a control of 39. 4, client receiving Theophylline who has a Theophylline level of 25. And guys, the correct answer is 4, that patient level of 25. Guys, the normal Theophylline level is 10 to 20. This patient already has a higher level than what's the therapeutic range. Why are we going to give this medication? Absolutely not. You're going to withhold that medication and you're going to call the doctor. Now let's look at our wrong answer choices. 1, giving prednisone, which is a glucocorticoid, and the patient's blood sugar is 140. This is expected because what do we know about glucocorticoids? They increase the patient's blood sugar. They can cause gastric ulcers, and they can cause porous bones, right? And the 4th thing is that they mask the signs and symptoms of infection. So we're not going to stop those from giving the patient the meds. We're just going to watch out for it. So if we have to give patient insulin for a little bit of time, we will. This is not too high that we'd have to do that, but this is an expected finding. So we're not going to question that. 2, the client getting Rifampin and the WBC is 15,000. Well, why do you think they're getting the Rifampin? They've got infection going on, so we're not going to question that. 3, the client getting heparin, the PTT 78, and the control is 39. That's fine. We want it to be 1.5 to 2 times that control, and that is within that norm. So we're not going to question that either. The correct answer is number 4. Next question. The nurse is discussing health promotion activities with a client diagnosed with chronic obstructive pulmonary disease. What information should the nurse discuss with the client? 1, instruct the client to get influenza vaccine semi-annually. 2, teach a client to take low-dose antibiotics at all times. 3, encourage a client to get pneumococcal vaccine every 5 years. Or 4, discuss the need to receive 3 doses of hepatitis B. And guys, the correct answer is 3, get the pneumococcal vaccine every 5 years. Guys, NCLEX is huge on primary preventative measures. What are primary preventative measures? Education and vaccinations. Okay, they're huge on this. So number 3 is the answer, especially those patients that have these chronic respiratory conditions. They need to be the first ones in line getting that pneumonia vaccine every 5 years and getting what? The influenza vaccine every year, not every semi-annually, not every 6 months. So number 1 is wrong. They need to get it every year. Choice number 2, they need to take their antibiotics when ordered, not at all times. We're not trying to get this patient to develop resistance to every single antibiotic in the world. No, that's wrong. And then choice 4, discuss the need to receive the 3 doses of hepatitis B. Guys, getting your 3 doses of hepatitis B is wonderful, but that's not specifically recommended for that patient with COPD. Where getting their annual flu shot and getting their annual 5-year pneumococcal vaccine every 5 years, that is recommended for the patient with COPD. The nurse and an unlicensed assistive personnel are caring for a client diagnosed with chronic pulmonary disease. Which action by the UAP warrants immediate intervention by the nurse? 1, the UAP encourages a client to wear the nasal cannula at all times. 2, the UAP calculates the client's fluid intake after the lunch meal. 3, the UAP increases oxygen to 5 liters while ambulating the client. 4, the UAP obtains the client's pulse ox reading. And guys, the correct answer is 3, the UAP increases the oxygen to 5 liters. Guys, oxygen is considered a drug. This is a medication. They should not be messing with that client's oxygen at all. And you know, patients with COPD, the most they can get is 3 liters. And even giving them that 3 liters, you're pushing it, right? So Excuse me, absolutely not. Now, UAPs, they're allowed to remind, they're allowed to say to the patient, hey, don't forget the nurse said to do this. Don't forget the nurse said to do that. They can remind. They're allowed to do INOs. They're allowed to transport patients. They're allowed to transport equipment. There's lots of things that the UAP can do. However, oxygen is not one of them. So you're going to question that. Everything else is correct. The client with active tuberculosis is prescribed anti-tubercular medications. Which interventions will the public health nurse implement? 1, request the client to come to the health clinic weekly for sputum cultures. 2, place the client and family in quarantine while the client takes the medication. 3, inform the neighbors and coworkers that the client has been diagnosed with TB. 4, arrange for a healthcare professional to observe the client taking the medication daily. And guys, the correct answer is 4. Arrange for a healthcare professional to observe the client taking the medication daily. Guys, tuberculosis is a public health concern because that patient has active TB and they go in the public place and they're coughing, they're breathing, they're sneezing, and people just walk around and they're walking in that same air and boom, they're infected. This is a public health concern. So those patients who are even suspected that they possibly may not be compliant, the government pays for what's called DOT, directly observed therapy. They pay for that nurse to go out to wherever that patient lives and watch that patient take the medication because this is a public health issue, okay? Let's look at the wrong choices. Number 1, sputum culture. Sputum culture is to diagnose TB, right? Once that patient's been diagnosed, we know for a fact they have it, they're placed on medications. They don't need to keep taking sputum cultures. Let's see our other choices. Choice 2, place the client and the family in quarantine. No, that client is going to be in quarantine for 10 to 14 days, and then they'll do a repeat culture for the client, but the family does not need to be in quarantine unless the family was also found positive for TB as well. Choice 3, inform the neighbor. Stop. You guys know all about HIPAA compliance, so you know that's false. 4 is the correct answer. Which statement by the nurse best describes the scientific rationale for how a non-narcotic antitussive works in the body? 1, it suppresses the cough reflex by directly acting on the medulla of the brain. 2, it reduces the cough reflex by anesthetizing stretch receptors in the respiratory passages. 3, non-narcotic antitussives slow down the destruction of sensitized mast cells. Or 4, it acts to block receptors for cystinosyl leukotrienes to prevent bronchoconstriction. And guys, the correct answer is 2. It actually anesthetizes the stretch receptors in the respiratory passages. And so that's why patients who have conditions, what's an example? Cystic fibrosis. Patients who have conditions such as cystic fibrosis where they're producing this thick, tenacious, a lot of thick, tenacious mucus, do we want to give an antitussive to them? No. Because if we give an antitussive to that type of patient, they're not coughing up that thick mucus. What do you think that thick mucus is going to do? It's going to be causing obstruction. And that mucus, which is fluid just sitting there day after day, what happens? Bacteria is going to settle in and that patient can develop pneumonia and other upper respiratory infections, right? So anyway, that's the action of antitussives. Very quickly, I want to go back to that TB question. There was one more thing I wanted to tell you. This is a famous test question. They love to ask about this as well. Most of the TB medications, you expect the patient to be on that medication for a minimum of 9 months. Usually a patient takes that medication for about a year, but some meds they can take between 9 months to 12 months, okay? So the minimum will be 9 months. That is your time frame, about 9 to 12 months that they'll be on the anti-TB medication. All right, the client with an acute exacerbation of asthma is being treated with asthma medication. Which assessment data indicates the medication is effective? 1, client has bilateral wheezing. 2, client's lung sounds are clear. 3, the pulse ox reading is 90. 4, client has no peripheral clubbing. And guys, the correct answer is 2. The lung sounds are clear. That's how we know that this medication is effective. It's working. Now let's look at our wrong answer choices. 1, client's bilateral wheezing. Come on, guys. If there's wheezing, is that med working? No. Wheezing is the sound that you hear when the patient's having an obstructed airway. That's the sound of air trying to get through an occluded or obstructed airway. So that's false. 3, client's pulse ox is 90. Excuse me? We want the patient's pulse ox between 98 and 100. The worst we'll take is 95, but preferably we want it to be 98 to 100. If that patient's pulse ox has reached 90, 89, 90, that patient's now in what? Respiratory distress. So that's false. And then 4, client has no peripheral clubbing. Well, we see peripheral clubbing in chronic respiratory disorders such as COPD, not intermittent respiratory disorders such as asthma. So the correct answer is hearing clear lung sounds. All right. The child with cystic fibrosis is taking high-dose IV antibiotic therapy, cephalosporin, Ancef, and is getting progressively worse. Which medication would the ICU nurse anticipate being added to the medication regimen? 1, IV corticosteroid. 2, IV aminoglycoside antibiotic. 3, oral proton pump inhibitor. Or 4, oral mucolytic agent. Okay, guys, and the correct answer is IV corticosteroid. What do corticosteroids do? They decrease inflammation. We're going to give this IV. We want to see that systemic effect. When that patient's doing really, really, really bad, they're going to get it IV, and that's what you expect to see. Now, choice 2, the IV aminoglycoside antibiotic, you'd give that depending on the culture and sensitivity. This wasn't even mentioned, so that's the wrong answer. Choice 3, oral proton pump inhibitor. We give PPIs for what? GERD, right? And choice 4, oral mucolytic agent. This patient's got cystic fibrosis and they're in the ICU. They're already getting this, okay? The patient's getting worse. We're going to give them IV corticosteroids. The client's arterial blood gases are the pH. Where am I? Sorry, guys. I lost where I was. The pH is 7.48. The partial pressure of oxygen is 98. The PCO2 is 30. And the bicarb is 24. Which action would be most appropriate for this client? 1, give 10 liters of oxygen. 2, administer anti-anxiety med. 3, give 1 amp of sodium bicarb. Or 4, administer 30 mLs of antacid. And the correct answer is 2, administer anti-anxiety medication. How do we know this is the answer? Well, go back and let's look at what's going on with this patient, guys. That pH is 7.48. Your regular pH is 7.35 to 7.45, right? So this patient's going through what? Alkalosis. Your PO2 is 90. Your PCO2 is 30. What is it supposed to be? 35 to 45, right? So that, and we know when we're thinking about carbon dioxide within itself is acidic. And that's down, and your bicarb is 24. So the correct answer is giving the anti-anxiety medication. Why? What is the anti-anxiety medication going to do? When you're anxious, you're worried, you don't know what's going on. But once you get the anti-anxiety medication, your breathing slows down and you start holding on to more CO2. And we know that CO2 is acidic. So the more CO2 you're holding on to, the CO2 is going to start to go up, right? That pH is going to start to go down. So that's why you're giving that patient an anti-anxiety medication. Now let's look at our wrong answer choices. 1, giving them 10 liters of oxygen. For what? Their PaO2 is 98. That's not the problem. So that's wrong. Choice 3, giving them sodium bicarb. This is a drug of choice for a patient that's going through metabolic acidosis. We want to give sodium bicarb for a patient that's going through acidosis. The patient, this clinical picture that we're looking at, they're alkalinic, not acidic. So that's wrong. And then choice 4, give them an antacid. Patient's already alkalinic. Why are we going to give them an antacid? Stop. No, that's wrong. So the correct answer is 2. All right, next question. Which intervention is priority when administering IV fluids to a 2-year-old diagnosed with acute epiglottitis? 1, label IV fluid with the client's name. 2, obtain the daily weight and post at the head of the bed. 3, assess the child's IV site for redness and warmth. 4, administer the IV fluids with volume-controlled chamber. And guys, the correct answer is 4, administer the IV fluids with volume-controlled chamber. If you go back to the question, how old is this child? 2 years old. Giving IV fluids to such a small body is very easy for that patient to go into fluid overload. And guess what? Fluid overload will kill a small child much quicker than it'll kill an adult. Okay, it is lethal. So we're going to make sure we have that volume controlled chamber because we don't want to kill our patient. The 8-year-old male is diagnosed with asthma and prescribed Theophylline. The child tells the nurse that if he's good at the doctor's office, his mom is going to get him a hamburger, french fries, and cola. Which action should the nurse implement? 1, encourage a child to be good so he can get his meal. 2, tell the mother not to use food as a reward for visiting the doctor. 3, suggest drinking Sprite or 7-Up with his lunch instead of cola. 4, explain that the child should not eat foods high in salt such as fries. Guys, the correct answer is 3. You want to suggest drinking Sprite or 7-Up with his lunch instead of cola. And the reason why, look at the medication that this patient's on, Theophylline. We want the patient to avoid anything that has caffeine in it. So that's why we're going to suggest the Sprite instead of the Coke or the cola. All right, guys, we are down to our last question. The nurse is preparing to administer the first dose of antibiotics to the client diagnosed with pneumonia. Which intervention should the nurse implement first? 1, check the white blood cell count. 2, determine if a CNS was obtained. 3, check the client's identification band. Or 4, teach a client about supra-infection. All right, guys, and the correct answer is 2, determine if a CNS was obtained. You always want to do this. Before you give an antibiotic, you want to make sure you have those CNS results, and you're going to look at it, and if there is something wrong, is you're giving a medication that the patient's not sensitive to. Are you going to give it? No, you're going to hold it and call the doctor and say, hey, I just got the CNS results. This is what it says. Are you sure you want to give this, or you want to give something else? And the physician's going to say, oh, no, I was just joking. I want to give this instead, right? So before you give an antibiotic, you absolutely want to check the culture and sensitivity results. Guys, I hope you found this video helpful. I promise I have much more pharmacology coming your way. If there's anything you'd like to see me cover that I haven't done so already, or maybe I have covered it already, but you want more of it, go ahead, leave me a comment. Let me know, leave me a comment under this video. Let me know what you'd like to see more of, and I'll make sure I make a video for you. Again, guys, don't forget to check me out on TikTok and Instagram and Nexus Nursing. Also, guys, very soon, matter of fact, by the time this video is released, my audio lessons might be out already. The end of March, I have audio lessons that are being released on my website, www.nexusnursinginstitute.com. Check it out for more information. If you'd love to have me right next to you every day while you're studying, just talking to you and telling you to stop the foolishness and telling you what's important to know because you're most likely going to see it on your test, and just explaining these concepts to you, you need those audio lessons. So make sure you check it out on nexusnursinginstitute.com, and I'll see you on the next video.